Hi, everyone. My name is Dr. Aisha Hussain. I am the Chief Medical Officer at Asian Human Services Family Health Center. We are a federally qualified health center located in the north part of Chicago and in the suburbs of Skokie and Niles. We see a mostly immigrant, underinsured, and uninsured population. Our population base is very diverse. We see patients from several different countries all across the world and from many different religions. A big part of the population that sees us is Muslims. And today I would like to talk to you about Muslims and immunizations, as is my experience at the 9 years that I've been at Asian Human Services Family Health Center. I'm going to start by talking a little bit about the Muslim community and who they are. People who follow Islam are called Muslims. Islam is the second largest religion in the world and the fastest growing with 1.8 billion followers. Why is this important? Why is this topic important in America right now? Because according to the Pew Research estimate, there are about 3.35 million Muslims of all ages in the United States, constituting about 1% of the US population. Another statistic to keep in mind is that by the year 2050, Muslims will make up about 2.1% of the US population. Next, I want to talk about some basic concepts of Islam, and this will come up in conversations with patients. And so it's important to understand what they're talking about before you could go ahead and answer their questions. In Islam, there is the concept of halal, which is what is permitted, and haram, which is forbidden. The tenets of Islam are derived from the holy book, the Quran, and the authentic translations of Prophet Muhammad known as the Sunnah. These two sources of revelation are a guide or a manual for life. Another important concept to understand is the law of necessity. A person is not guilty of sin in a situation where the lack of a halal or acceptable alternative creates an undesired necessity to consume that which is otherwise haram. Basically, what it's saying is that which is necessary makes the forbidden permissible in exceptional circumstances. There are 28 verses in the Quran that focus on diet and nutrition, personal hygiene, alcohol abstinence, and the importance of a healthy lifestyle. So as you can tell from this, Islam is a religion that basically promotes prevention and preventative health. The Quran has used the concept of prevention in many situations, and since immunizations are a form of prevention, they are not prohibited in Islam. Another important concept that comes up when talking to Muslim patients is the holy month of Ramadan. So Ramadan is a month in the Islamic calendar where all Muslims are required to fast from sunrise to sunset. Current Muslim guidelines authorize therapeutic or diagnostic injections during Ramadan. But, and I found this in my practice, most patients that are Muslim are not willing to get immunized during this period. There's a study published in the vaccine, the May 2017 edition, that said only 40% of Muslims said that both vaccination and blood sampling were allowed, even though religious leaders were most favorable to vaccination and blood sampling. Hajj is the holy pilgrimage. Islam requires every Muslim who is physically and financially able to make the journey to the holy city of Mecca at least once in his or her life. It occurs 2 months and 10 days after Ramadan ends. You may hear them talking about the Umrah. This is the minor pilgrimage and can be completed at any time of the year, and it's not compulsory. Now, I have found that when a Muslim patient is going to Hajj or Umrah, because the Kingdom of Saudi Arabia, where the Hajj is held, mandates that these patients or people have proof of the meningococcal vaccination, it's a great time to talk to these patients about immunizations in general. For American travelers or American Muslim patients going for the Hajj, the CDC recommends that they be up to date with all routine immunizations. So this is an excellent opportunity to talk to them about immunizations and to promote immunizations. I'm going to now move on to my experience with Muslim patients and their attitudes towards immunizations in my practice at this clinic for the past 9 years. A little bit about my clinic, Asian Human Services Family Health Center. It serves a predominantly immigrant population and sees a large number of Muslim patients. I have found that attitudes of patients towards immunizations are not based on religion, but based more on their geographic, cultural, and socioeconomic backgrounds. So what I've seen is if there's a Muslim patient from India, then their attitudes towards certain vaccinations are completely different from a Muslim patient, say from Somalia or from any other African country. I often get questions about the contents of the vaccine and whether they are halal or permissible by our religion, because pork is haram or forbidden in Islam, and a lot of times we get questions about whether the vaccines contain any pork products. That would probably be the most common question that I get. A lot of patients refuse vaccines during Ramadan, even though the religion doesn't really prohibit it, but that's just the attitude amongst Muslim patients. In my 9 years of practice, I have not filled out any vaccine waivers on religious grounds. And in talking to the 12 other doctors that I practice with, none of them have filled out vaccine waivers on religious grounds for Muslim patients. So I think by and large, there is an acceptance of immunizations if you're looking at it from the point of view of religion and the fact that they are Muslim. Amongst the Muslim population, the resistance that we see is with the MMR vaccines. We see that a lot with the Somalian Muslim patients, but again, I feel that has to do with them being from that country and not from the religion. We have a resistance with the HPV vaccine a little bit, because again, Islam promotes sexual abstinence before marriage, and we sometimes get into discussions about that. There is a resistance against the influenza vaccine, and again, I think that comes from just lack of knowledge about prevention and knowledge about influenza, and not really based off of their religious views. I found the resistance is to the number of shots needed rather than the actual shots themselves. A lot of these Muslim patients are immigrants and coming from different countries, and in their own country, their shot record is complete. And often the fight with the physicians or the resistance to getting shots, I should say, is coming from the fact that they think that their immunization record is complete, and why do they need to get more shots? Again, a country or a geographic concern, but not something that is to do with like religion, in my opinion. So like I said, having to struggle with this concept of shot record was complete in my country is very common in our clinic, where we see a lot of these immigrant patients. I feel that even though Islam promotes preventative care, it is an alien concept in developing countries from where a lot of these Muslim patients are coming to our clinic. And that's kind of where the resistance is at, in terms of just lack of knowledge and then lack of access to preventative cares in their own home countries, which kind of makes it hard for them to understand why their children need all these vaccinations or why they need vaccinations, rather than something in their religion that's preventing them from getting these vaccines. Thank you.